Hi, this is Derek. I am COO of International Association for Dental Specialists, and I'm just with my pal here,
Kenneth Taylor.
Say hello.
Hey guys, how you doing?
This is Kenneth Taylor. He is currently a door attendant at the Ashford apartment building on the Upper East Side. Thank you, Kenneth, for spending some time with us.
You're welcome.
So just a couple simple questions.
Sure.
So, have you went to a dental specialist?
Yeah.
You have. So what kind of dental specialist?
As somebody that was, I needed somebody to examine my teeth, what's going on, and I had a bad tooth I needed to pull out.
So was it a specialist or was it just a general
I'm
dentist?
just a general dentist.
Okay.
I don't even think it was a specialist because at least they do. A specialist does surgery too, dental surgery.
Some do.
Yeah, this guy is your typical dentist.
And so I think we were speaking earlier and you said that you really don't like your dentist now. So talk to me a little bit more about that. Why don't you like your dentist now?
Because it seemed like he didn't know what he was doing.
Mm-hmm.
You know, I've had teeth pulled out before, but this guy had a problem with pulling this tooth out. It didn't seem like I was fully numb. And I felt every pull, everything.
So it was painful.
It was very painful. And I've never, granted, pulling out a tooth can be painful, but not like this.
Mm-hmm.
You know, and like to the point I was in tears. They had to give me they prescribed 800 milligram Motrins, ibuprofen. And I pretty much took that whole bottle.
Did you go back to the dentist after that?
Mm-mm.
Why not?
Didn't want to, because I was like, you know what? It was just something about this guy that was.
So if I was to tell,
I think I should have done my due diligence at looking for the right dentist.
yeah, but you didn't know. You weren't educated.
I wasn't educated at all about it.
Right.
And that's the problem. And until I get educated on it, I won't go to another dentist until I know what to look for, what to ask, what kind of questions to ask, you know.
So if I was to tell you that a dental specialist has years of experience in their craft, practicing on patients, years of education and practice, but also years of education being taught the very best ways to treat patients, right? Not just bedside manner, but also the ability to provide you with excellent care, to get excellent outcomes. Would you visit a dental specialist?
Yes, like if you know how to give us the perfect care, the right care for us, to take care of what was going on and not force any more pain than what I was going through. Yeah, that's great. Bedside manner is a plus, but that stuff right there is more important, you know.
So my dad, Dr. Farber, he's a periodontist. He's been practicing for 30 plus years. He went to UPenn Dental School.
Okay.
Right? And he has the best personality. He's a nice guy. He's a caring guy, right? He'll listen to you. He'll listen to your problems, what's going on in your mouth, and he'll just give you what your options are. And you can make the ultimate decision yourself, but at least you have all the education to make that informed decision. How does that sound?
That sounds great, especially if you have somebody that's giving you options. This is what can happen. This is what we can do. You know, and that's what we need. You know, that's what, a lot of people out here, but we just don't know. We're not educated enough to know what kind of questions you want to ask, and to make sure that we get the right care and that stuff is very important, because that you can see how a lot of people get the wrong treatment, end up making themselves sick. You know, that stuff is very important. Education of anything, but especially education on what you're getting done. It could be dental work, it could be cosmetic surgery, it could be podiatry. You know what I mean? Education on it.
So I think a lot of people have education, but they have education in medicine. They have education, all the resources are online, people are talking about it, there's advertisements. I wouldn't listen to those advertisements, but that's just my opinion.
Right.
Now, the thing is that all those advertisements in dentistry, they focus on the general dentist. They don't focus on the specialist.
Right.
So everything you see in the news, in the commercials. It's all focused on someone who's went to 4 years of dental school, maybe 2 years of residency, but hasn't actually
done it.
No, they haven't actually taken the extra time to be experts in a specific part of dentistry. And that's the difference. So if I could help you and set you up with an appointment with my dad, Dr. Farber, would you love to meet him?
Yes, especially if it's experience. You know, years of experience versus 2 or 4 years. Not saying that you don't know what you're doing in those 2 or 4 years.
But additional practice.
Additional years.
Additional
practice.
education.
Exactly.
Focusing
Out.
on one specific specialty.
Exactly. It outweighs the 2 or 4 years. I'm sorry, it just do. And stuff like that makes me feel a lot more secure.
All right.
You know, as a patient.
So that's it for you guys. Thank you, Kenneth.
You're welcome.
I really appreciate it. And thanks so much for your time.
Anytime.